Well, good morning. It's so good to see so many of you. I just want to do a quick audio check before we jump into this. Melissa, can you hear me okay? Am I coming through clear?
I can hear you.
Okay, great. Well, wow, we're very excited. The long-awaited 1115 waiver. It's been a busy week and a half, 2 weeks at this point in time. As many of you are likely aware, the 1115 waiver was released by New York State last week as part of just in the morning, just prior to Governor Hochul's commencing the State of the State address, came out the waiver release. And then just this week, out came the RFA associated with the social care network role for the waiver. And so as soon as our team saw this, we said, we've got to have a quick stakeholders meeting, get everybody together, share ideas, share some of the things that we've started to see. And this is thick. So I think this is the first meeting of many meetings. We'll try to do some in-person meetings at another point in time. But for today, just facilitating everybody, we said, let's just do this by Zoom. We tend to get the most people when you have Zoom available across this kind of a region, but we do want to have some in-person planning meetings at some point in the future as well. And I appreciate you letting us record the meeting today. There's a lot of people, you just push out an invite, they can't make it, so we are going to make this recording and these slides available. We welcome you to share this with your coworkers, with board members, whoever it is that you find might be of interest. So big topic, we only have 7 slides. We're trying to keep this high level for today, and I'm going to just jump right into it. Alexa, you can go to the next slide. So what I'm going to try to do today, the real goal is, I'm assuming you've seen this, you've heard this, you've had some conversations, but you've not invested a lot of time to read all of the documents. And even if you have invested time to read all the documents, it's not likely you've read all the documents because it's been a lot that's come out. So I'm going to try to cover this as we've read it, as we understand it. And I will say this is constantly changing as we talk with more people from across the state, and yet to hear any commentary from New York State itself. Our understanding of this does evolve over time. So that's the one caveat, that I might have an understanding of this today, and we might refine that or shape it as we go forward. But the first piece that's really, really exciting is that the 1115 waiver was approved. I think it's right near $7.5 billion. That was a big question mark. New York State, in our past stakeholder meetings, when we were talking about the waiver, we really didn't know the magnitude of funding. They originally wrote this as a $17 billion waiver. Then they resubmitted it. When they submitted it, it was $13 billion. And then a lot of time went by. We've been talking about this since January of 2023. And so we've been wondering, what will CMS approve since there's less time to achieve this waiver? So we're very excited to see that magnitude of funding coming in to support the Medicaid program in New York State. There's a lot of details to the waiver, but at a very, very high level, there's 4 core areas that the waiver is going to focus on. And those are at the top of this slide here. For one, you're going to have Medicaid billable services that are called health-related social need interventions or services. And those are going to be coordinated by an entity called a social care network. Separate there is a fund that's been set up for financially distressed hospitals. But by our read, and you can see the parentheses here, this really seems to be something that the state at this time is only investing in select New York City counties. So that's something in our region, we're likely not going to see a lot of that come into play, but that there is $2 billion of relief for financially distressed hospitals. There is also a workforce domain. Unlike DSRIP, where Care Compass Network was the lead PPS and we were doing the projects, we were doing workforce, or we had sort of a lot of different areas of responsibility that we focused on. Workforce in and of itself is going to be conducted by another agency called Workforce Innovation Organization, called AWIO, which is the shorthand. I don't love it, but I'm just telling you what people call it. So the WEOs will be the agencies that coordinate the workforce investments. And for the purposes of workforce, the state wants to create 3 regions. I haven't seen a map for this yet, but essentially there could be up to 3 WEOs serving each of the 3 regions. And I'm not going to go too deep into workforce today. What we've not seen yet is the RFA come out for workforce. So we know a little bit less about it at this point in time in terms of when the state is going to get started, when the state is going to contract with them. But that is something that Care Compass Network will be paying a lot of attention to and help facilitate that information to you. So let's say there's been an agency awarded the WEO, they're going to be making investments in workforce locally. We'll try to streamline that information to you through our newsletter and things. But Care Compass Network does not intend to apply to be a WEO organization for upstate. There are existing WEOs, if you're familiar with the program. They're documented and defined in the New York State DOH website. Iroquois, that CCN used previously to do our comp and Benny surveys for the district program, is one of them. There's several others. I think Flips is actually a WEO on the website as well. Andrea's nodding her head, so I'll accept that as a yes. So there's a lot of these organizations out there today. I do not believe that because they've previously been assigned or worked as a WEO, it guarantees their role for purposes of this waiver. So that I do expect that to be a competitive RFP. And the 4th domain is health equity. This was also a big question mark that we had all the way up through this point in time. How New York State had described this was that initially they wanted to have health equity organizations called HEROES in each of these regions across New York State. And now what they're saying is there is going to be one health equity organization or a HERO that's going to serve all of New York State. And that organization is going to have certain responsibilities, identifying best practices, reviewing outcomes, and making recommendations to each of the regions across New York State on how they can better improve health equity outcomes in their particular part of the state. I'm going to get into some specifics on the waiver as I go through this, but I'm not going to focus a lot today on items 2, 3, and 4. We have to just condense this down. We do have an RFP or an RFA that's out for the first line item. So I'm going to spend a little bit more time on that one as we go forward for this meeting. The second piece here is that, so the waiver came out and then we saw the RFA, and the RFA is shorter. It's not 200 pages. It's 70 plus pages, a little bit easier to digest, but there's a lot of information in there around the timing. And so we can speak to this. For one, we know that the responses are due March 27th. No funding would be deployed prior to March 27th. That's just the application period. So the waiver is out, but we're starting to look at when does all of this get stood up? Well, the state intends to contract with social care networks by August 1st of this year. The end date for the contract will be March 31st, 2027. That's an actual date that we know. This is an 11/15 waiver, and the hard end date for the waiver as it exists today is March of 27. So all the work that we'll do is intended to start whenever we can contract with the state, hopefully by August 1st. But the work will go from the start date of the contract through March of 27. Another interesting piece is the state has already identified attribution and went through evaluation process. There is infrastructure funding available to each of the regions to shore up internal and partner-based infrastructure needs. And for the southern tier, they've identified that to be $22.6 million. That amount is very front loaded. So I think like 10 million of that would be available potentially this year. So it's meant to be very, very front loaded in terms of spend and outlay into the community. And then in addition to that, there's separate funding available for the health related social need services. So Alexa, you can go to the next slide. I'm going to start to dig in a little bit to some of the mechanics of the budget and then the regions and how this is all defined. So this is just a snapshot of how the state, on the previous slide, I had gone through the core areas of the waiver. This is how the budget works for each of these areas. We were very, very surprised to see this was not the case when the waiver first came out. The work of the social care networks and the work of delivering health-related social needs is almost 50% of the waiver. And that is way higher than the initial estimates by the state. So if you're comparing what did they originally submit and what does this look like now, that is a significant change. So there's two line items at the very top of this for social care networks. The first one is for the delivery of health-related social needs. And I will get into the specifics of that. I think that's where a lot of our attention is going to be as we go forward, just the coordination of how those all work. But the next line item down is the 500 million for infrastructure. So when I mentioned on the prior slide, the southern tier was awarded $22 million. It's 22 million of that $500 million bucket. And in the text there, this is directly out of the waiver document. It says you're sort of giving some description of what infrastructure dollars mean. It's for setup costs in each region, including but not limited to initial network infrastructure, referral systems, staffing, coordinating CBOs, capacity building for CBOs, and contracting needs. So the state has, put a little bit of a vision out there about what they think infrastructure could be used for, but the fact that they say it's not limited to speaks to me that they're going to allow some discretion from the social care networks on maybe some other infrastructure needs that aren't identified here. And we love to see those things because if we've learned anything from DSRIP, it's not one size fits all. There are very unique needs, and they've given a little bit of flexibility here. You can also see the magnitude of funding. There's one singular statewide hero that's going to be $125 million. You have over $2 billion going to the New York City region hospitals for financial distress situations, and then also a little bit about the WIO, which is really going to focus a lot on recruitment, tuition, reimbursement support, career planning, things along those lines. Let me pause here. I'm working my way through the slides, and I promised I would give pauses to the team if I've missed any key points. So just to the CCN leadership team, any additional comments you want to make before I go into the regions? All right, we're going to keep going then. Alexa, we can go to the next slide. This was also another unknown thing, and now we know more, for good or for bad, is that the regions have been formally defined. Following the public comment period, May of last year, what New York State did was they said, we're not going to define the regions at this time. And then they further said that they're going to let the social care networks apply via competitive RFA. And so we had assumed up through this point in time that the state would allow you to identify your region. What they've done in the new waiver is they formally identified these counties will be attributed to these particular regions. And so so this thing could all fit on this slide. I took out the New York City region, so you can see like region 4 isn't here, and that just saves a lot of space. So New York City is not here, but you can see for the southern tier, it is not the same 9 counties that we served for DSRIP purposes. And on the right here, you can see, sort of in and out. In and new for the southern tier is the introduction of Otsego County. And what we did here was we put next to Otsego County, these are the Medicaid enrollee numbers according to the New York State DOH website. So you can sort of see not just from a county perspective, but also the covered lives component as well. Counties that previously were in the southern tier for DSRIP purposes, but not in the southern tier region for purposes of this waiver are Chemung, Cortland, Schuyler, and Steuben. Those Chemung, Schuyler, and Steuben were assigned to the Finger Lakes region, as you can see, which is region 5, and Cortland was assigned to the Central New York region as well. So those are big changes. We have a lot of questions on if the state has flexibility with that. But outside that, I think the biggest thing to understand is that CCN still has a lot of commitment and desire to work with the 9 counties of partners that we've classically worked with. So we are going to be very strongly trying to find ways to support organizations that span multiple regions. If these changes stay or if other changes happen, I think it's very likely that we'll have organizations that you serve in one county, you serve in another county, and then technical questions will come up because of that, because you might find yourself spanning multiple social care networks. And maybe I didn't state it, but I should, is that the state intends to award one social care network per region. And so you can see there's the 9 regions here. You could have a situation, and in fact, a very likely situation, where there's a unique social care network for each one of these regions. And that's where if your organization spans the service areas, there's going to need to be a lot of coordination and collaboration around how that happens. I can tell you, yesterday I met with Carol Tegas from Flips. I met with Erica from Healthy Alliance out in the Central region. I'm meeting with the Inclusive Alliance from Central New York later today. So we have active relationships with sort of all the neighboring regions. And we're sort of right now, we're trying to understand, what do these regions look like? And what are the scope and roles of the social care networks. But as soon as we can find ways to collaborate on the waiver, we will, and hopefully try to make it as easy as possible for organizations that span multiple regions. We don't have the specifics on that yet. It just came out. So we can, Alexa, I'm going to go to the next slide. And I think this is where we start to jump into the mechanics. Yeah. So in DSRIP, many of you were involved in the DSRIP program, and it was very project-based. So we had defined projects with achieved the demonstrations we were trying to get done, documentation standards. We all remember speed and scale and capturing SIN numbers and all those kinds of things for those of you that were there. In this new waiver, what the state has identified is that if you're a CBO, I'm kind of making this CBO-centric because it's very heavily CBO-centric, you could deliver enhanced services. So I'll call them standard services. We'll see them on the next slide. And if there's a health-related need assessment that's performed, always you can refer somebody for primary care, some of the existing billable services that are out there. But what this waiver introduces is 18 different enhanced services that there's a spend down pool that we saw in the budget chart, which is about $3 billion. So the $3 billion for HRSN services are for these enhanced services that are defined in the waiver. There's 18 of them. I just put 4 of them here just so you can see some of the examples. The way that the waiver works is the starting point is the completion of a health-related social needs assessment. And the state has defined the tool that's going to be, but the starting point is the completion of the needs assessment. Once you identify somebody that has a need, such as something that would be benefited by one of these enhanced services, they then have to go through a secondary screen. And Alexa, I'm going to toggle between the 2 of these, but if you go to the next slide, this is the qualifying review that would need to be done before a referral for the enhanced services is made. So before some of those interventions that are going to be billed and paid out of that $3 billion pool, this sort of assessment has to go through. So the door number 1 is you do a screen. You can always make a navigation to existing state, federal, and local programs to address health-related social needs. But this list of 18 enhanced services that are going to be payable out of the waiver funds would only be performed if the person screened that they had a need and they also met one of these qualifying characteristics. So you can see children under the age of 6, pregnant persons up to 12 months postpartum, Medicaid high utilizer. So I say this is different from DSRIP because in DSRIP, let's say we did the navigation program, you can navigate every Medicaid member, and we encourage it, that came through your organization in a calendar year. In this program, you can't refer everybody just because they've identified or screened positive for a health-related need. First, you have to also verify that they have one of these qualifying eligible characteristics to be able to go forward. So you do a health needs assessment, you identify health-related need interventions, then there's a screening that's done to make sure they qualify for these services as the state has defined here. And then we could deploy the services. So Alexa, if you go back to the prior slide, sorry, forward one more. On these enhanced services, these are services that as part of this waiver will be billable to New York State Medicaid. And that's another big difference and change from the DSRIP waiver. In DSRIP originally, what happened was the PPSs, they picked their projects, they came up with the interventions. We literally created the funding model. Many of you were in the room when we said, what's the best way to price these and pay for these? It's this new innovation program. How do we get that done? In this case, each one of these is going to have a payment schedule set up as defined by New York State. And that's not out yet, but you can see here the completion of a health-related need assessment using the ACH tool. That's going to be Medicaid billable, and the rate for that is going to be set by New York State. And I believe also those rates are going to fluctuate by region. So presumptively, Binghamton is going to have a lower rate schedule than New York City, if that's typically how they would do that, just to make an example. So there's a lot that we don't know about the rate schedule yet, but yes, these are Medicaid billable. No, I don't know yet the rate that's going to be correlated along each of these. So that's going to be really important because that's going to be an important internal business decision to say, hey, how can I support or do one of these programs? One of the first questions is, well, how does the state reimburse that compared to what is my operating model or my cost to deliver these services? The functionality of the social care network will be essentially that it will serve as a payer to CBOs that deliver these services. So a CBO partner will, in DSRIP, we submitted invoices. So there was an invoice, there was maybe an attachment of the work that was performed through the SFTP site. There was an attestation letter that said, hey, we delivered these services. In this, the state is treating it a little bit different because the social care network is going to be a Medicaid billing agency. And essentially, what the CBOs will be asked to do if they perform one of these 18 enhanced services, they'll submit a social care claim to the social care network. Now, social care claims will be templates and things that the state will define. So, in DSRIP, we had our own submission forms and different things like that. For purposes of this waiver, it's looking like the state, and I'm thinking this is so they can expedite how quickly this waiver moves forward. They're defining a lot. They're defining, these are the 18 interventions. They're defining, these are the types of interventions that qualify. These are the rates for the interventions. And also, this is how you submit your social care claim for these interventions. So the state is being, I think, in a way, more definitive than they were with the projects. With the projects for DSRIP, we really had a lot of latitude to define how that all worked. In this case, especially because there's 3 years left to really perform on the waiver, I think the state's just defined all that and said, just go deploy this. The functionality of it is the state says initially we want this to be fee for service. And so there's going to be a transactional fee that they're going to define to reimburse for these activities. And we have yet to see how this works, but they say by 2027, we want to see this be a risk-based contract. So does that mean risk gets passed down to the social care network, or does that mean risk gets passed down to individual CBOs? There's a lot of questions that we have around how that would be achieved, especially in a very short period of time. But the state's vision is that you have an SCN in contract with an MCO, receiving payment and adjudicating claims with CBOs. So this waiver does address something that wasn't addressed in District 1.0, which is the MCOs have a very critical involvement factor from day one. One of the first steps that the social care networks have to achieve is getting into a contract with each MCO in their region with managed care. So the state right out of the gate has included the MCOs, which just wasn't a part of the fabric of District 1.0. I'm going to go to, I think I've got one last slide here. Alexa, if you can go forward, one more from here. Perfect. Okay. So we have an hour time block. The goal was to spend about 30 minutes just overviewing some of these high-level frameworks. I think you can see why I didn't even try to bring workforce into here. I didn't even try to bring in hero. We don't even know who the hero is going to be yet. I thought, let's focus just right now the high-level information on the waiver, and then come into an open dialogue, Q&A, questions that you have. And just to prompt that off, I'm going to just go through a few of these things. Number one, a very common question is, how can I get ready? I get a lot of calls, hey, Mark, the waiver came out. How can I get myself ready? What recommendations do you have? And that's organization specific, but to be very generic about it, number one is know your costs, because at some point in time, New York State is going to be releasing a grid that says, here's what we're going to reimburse for these health-related need interventions. And your organization is going to have to really review that and say, can I deliver that service for the rate that the state has defined for it? Unlike District, we're not going to have a lot of latitude to increase rates because it got wrong. It's just it's a rate schedule that's coming out. Another one is know your capacity. Care Compass Network, we're going to intend to apply for the social care network role for the Southern Tier. And one of the asks, if we're awarded that role, would be to help coordinate health-related needs with all Medicaid members. And one of the things that would be very top of mind for us is, what capacity does your organization have to be able to serve the region? And so that's another one that I think would be a very early kind of survey or information gathering point, would really be to say, hey, in us helping to coordinate the efforts of the social care interventions, what is your organizational capacity? And so if you can start to think about that now, I think that'll be a good conversation for later this summer. I'm happy to see the timeline that this RFA is not due until March 27th, but the state did put in here a very early deadline that you should be aware of. And it's that there's a question and answer process built into the waiver, the RFA for the social care network. But all questions related to that RFA are due by January 31st. This is a good time for us to ask, mechanical questions around how some of that works. We do have our own little pile of questions that are building up, but you should be aware if you were intending to apply for the social care network role, or if you otherwise had questions and the state's going to have to formally, review and respond to them, there is a deadline of January 31st. If you have I'll say this one first. If you're looking to stay connected and understand information, right now what we have available is our CCN newsletter. If you're on this call today, it's because you probably have, if you're on our newsletter distribution list, you're on our mass email distribution list, so you saw us send this out, so you're already connected. But if there's organizations that aren't here today, or you're looking for, hey, how can I get them on that same distribution list? You can just make a request right on our website. There's a section called Contact Us, or also Amira Afifi would be our primary contact for getting organizations on that distribution list, so they can see future communications. Again, this is meant to be a quick touch point. We do want to have more forums and planning meetings in the future. So that's the criticality of that list, is you'll see all the communications on future waiver planning meetings that we organize. Another question would be like, hey, cool, infrastructure funds are available. How soon would those be available to the community? What's a reasonable time frame for me to expect? And I'm just backing into this, so there's a lot of assumptions on this. But if the state is going to have a controller authorized contract by August 1st, I have to assume the state's not going to release funds until that contract is in place. And maybe within a month they start issuing funds, and you got to give a month maybe for the SCN to get contracts with CBOs, do some needs assessments, and find what are the needs of the infrastructure for the region. So I could see on this, just walking through it, it's aggressive, but I could see infrastructure funds starting to go out in October. Again, there's a lot of, maybe the state does pre-spending and earlier this year, but just going off of, contracting timelines, that's sort of what makes sense based on what they're putting out at this point in time. So that's related to the 22 million, and about 10 million of that would be available this year. The next piece, and the biggest piece, is the $3 billion that's available to bill, or I can't say bill, I should say submit a claim for the delivery of a health-related social need service. When would you be able to bill for that, or submit a claim for that? I'm going to keep saying bill. I got to get over it. When would you be able to submit a claim for that? I'm seeing that one as potentially later this year, maybe Q4. Again, I think that's a little bit early because that one has a few more mechanics involved. If you remember a few slides back, you have to do a health-related social need. You have to do this qualifying review, then make a referral, then do the service, then submit the claim. So that might be a little more timely to stand that up. But I'd expect that maybe if we're in a good position, we can get those started by Q4 of this year. But the ramp up of those into 2025 would be really, really heavy. As a CBO entity, can you join more than one social care network? Absolutely. If your organization spans multiple regions, it will be very, very likely. I can tell you, I'll call them all of the aspiring social care networks that I've met from across New York State. We're all talking. We have a commitment to try to find ways to work together to make it easier for all the organizations to roll into this. Unlike DISRP came out, it was very difficult right out of the gate to know how to collaborate. It was so new. We were understanding. We all had different projects. This is different. It's all the same grids. It's all the same payment schedules. It's much more standardized. It makes it a lot easier for us to know how to coordinate. So we are actively talking about that. We don't have any final or confirmed plans yet. Nobody's even been awarded the role of social care network yet. But that's a commitment that we're making, that we would collaborate. And if you do span multiple regions, definitely we would have a strategy on how to support you and make sure it's an easy process and you're not having to do multiple systems, all the headache things that can come along with it. Let's say you're going along the journey. Maybe you're watching this recording, you weren't able to be here, or you leave this meeting and you have a question pop up. We have assigned a project manager at CCN who's going to be the lead person for fielding all of those questions and helping make sure we get you a response. Kim Slezak, her email address is here. Kim is also on the call today. So Kim will be happy to receive all of those, and we will get a very timely response to you for at least for things that we can find answers to. But there's a good chance that questions come up that we don't have the answers to, and we can aggregate those and send those to the state during that public comment period time on January 31st. So if you do have questions, pass them along. We'll try to answer what we can answer, or just raise up to the state and escalate what needs to go up to them. And then last comments, there are some things out here that we just don't know yet. For one, what New York State announced in the RFA is that they're going to be publishing a social care network program manual. And this manual is going to have much more tactical information around how the implementation of the waiver is going to go. They don't have a timeline on when that's going to come out, but if you look at in the waiver document, the list of enhanced services, those 18 enhanced services that could be performed if somebody screens as having a need for a health-related social need. Transportation is the very last one on that list. And it's like, there's a ton of housing interventions identified. There's a ton of food insecurity and nutrition interventions identified. And then there's one line for transportation, and it says, we're going to be defining more of this in the manual that's going to be coming out. So that's an example of, yes, this RFA is giving us a lot of information, but this program manual is also going to have additional information that's going to be very, very relevant to some of the partners. So just to come ahead of the, if you're a transportation agency and you're looking at this saying, wow, we really, there's only one line item. It's one line item, but potentially could be more or could be further refined based on that manual coming out. Another interesting development from this waiver is the introduction of a role called the social care navigator. In all of our work up to this point in time, if you're a CBO organization, we've been talking about CHWs and placing a very heavy role on the CHW role. For purposes of this waiver, the state is putting a very heavy presence on the social care navigator role. It's the social care navigators that would be conducting the health-related needs assessments. It's the social care navigators that would be helping to identify if they meet a qualified characteristic for the delivery of services, and then also coordinating the referrals. It's a very, central position for the waiver. And when I look at it, I haven't seen in the RFA yet any guidance that says, here's trainings those people have to have, here's certifications those people have to have. There's none of that kind of guidance. I potentially, maybe the state will issue some of that guidance in the SCN program manual, but I'm not sure. So right now, there's no guidance on the framework for that position, but potentially that could be something that would be published by the state at a later point in time. Also, I mentioned this earlier, the payment grid outlining the fee schedule for the enhanced services, that's not out yet. That's going to be, whenever that comes out, potentially that'll also be in the manual. That's going to be a real interesting one to look at and really do some organizational planning on. And also, the WIO RFA hasn't come out yet. So when will, I can tell you from the Social Care Network RFA, the state wants to contract with us by 8/1, and using that, I can back into when infrastructure dollars might start coming out. Because the WIO RFA hasn't come out yet, I can't do that same kind of, back of the napkin math to really know when is some of the workforce investments going to start coming out. I do know it's potentially and very likely going to be fast because there's only so many years behind the waiver. But when that WIO RFA comes out, that might allow us to really see when some of the workforce investments would start coming out. So Alexa, you can pull the slide down. Again, we'll make these slides available after this meeting. Just wanted to transition the rest of the call here just to open dialogue. If people have questions, if there's critical pieces of the waiver that you've heard that I didn't cover, and there are many of them, feel free to share, but just wanted to use this as a stakeholders town hall to be able to share comments and feedback amongst the group. So I'll go on mute and just welcome anybody to unmute, introduce yourselves and just share your remarks.
Hi, I have a question. I'm Joe Sammons. I'm the executive director at Hospicare, which we serve Tompkins and Cortland counties. So lucky us, we're now split out of CCN and whoever's north of us. But the question I have relates to funding for things like case management and care management. Do you see CCN having a sort of decisive process in rationing the resources that you have? I would bet a lot of us would have services that would fit under the umbrella of that category. It's a fairly large category, right? It includes navigation and some other things. Do you see yourself trying to ration requests for, we know the state will set the amount, the fee for service amount initially for whatever care management or case management we introduce here. But is CCN going to be the one that sort of says, we don't want to spend too much in this area, we want to spend in that area, or how does that work?
That's a great question, Joe, because I think I have an answer. Um, so if somebody qualifies and CCN doesn't have a role in that, the states define that. So we would just be, if somebody has these different screens and has documented clinical conditions, then they would be eligible for referral. I guess one point of the question would be, how does the referral system work? Who gets the referral and who doesn't? That's one piece of it. I can say in looking at the application for the SCN, the state is getting very granular to know, what organizations in your network serve, by zip code. So the state is getting to be like very, very granular. So some of it might be zip code by zip code based. But to get to the broader question about the funding, um, as I understand it today, and this could evolve, is that the 3 point, whatever $billion, it's a spend down. So we're not limited I guess maybe we have a budget. I don't know, Bob, there's no defined budget at this point in time for the social care network. Is there, Bob?
For the health related social needs, Mark, or for
Yeah.
the well, it's the 3.2 billion across the state. So in our estimation, that approximates to about $60 million of funding for the Southern Tier region as it's currently defined over 3 years for delivery of those services.
Yeah, so we've not had any planning on how to, strategically coordinate services so one service line doesn't dominate it above another service line. It seems like we'll be given a budget and a spend down strategy relative to that budget. I think it's a good question. It's an advanced one if we get to that point in time. But more of our concern would be we have more referrals to make than agencies that can receive and respond to them. I think that the budget here is healthy. It seems, at least from some of our advisors, we might find ourselves more likely to have the inability to meet some referrals than the overproduction on some. I am seeing some chats come in. I'll take them. I have to go back to see what was the first one that came in here. Okay, so question came in. Hi, Justine. What do you see to be the relationship between the IPA and the waiver, especially if a CBO is already doing the paperwork to get up and running under the IPA? Will that paperwork be transferable? That's a great question. That is our intent, Justine, now that we've seen the RFA, we can ask our legal team to review that. But if everything works out as planned, the Care Compass supporting IPA would be the applying organization for the social care network role. And if it were awarded that role, we would use the existing IPA contracts as the starting point for engaging with the interventions that are out here. I don't want to get into the contracting mechanics, but for DISRIP, we had an Appendix C, and the Appendix C is what framed up all of the interventions and the payment grids, all that kind of stuff. We can't make that yet because we don't have the fee schedule. We don't know how all that stuff really works. But yes, we would intend to have those IPA documents be transferable for purposes of the waiver. Another question from Justine, will CCN be reaching out early to get the invoicing process via EMRs? I imagine would have to get up and running. Yes, that is, in terms of early infrastructure, that seems to be, my guess would be a strong area where early infrastructure funds would be going. There's connectivity to CBOs and also connectivity to the Shiny that has to be achieved within 6 months. So that seems to be, a very early thing. We could start doing that now, and then also if awarded the role and we got the infrastructure funds, that could also be an area that funding gets aligned for. Andrea asked the question, while CCN is very well positioned to be the SCN for the Southern Tier region, do you anticipate any competition for the SCN for that region? I don't know. If somebody's planning to apply, then that would create competition. I've not had anybody reach out yet and say, hey, just a courtesy heads up, we're applying, or we intend to apply. They don't they don't owe us that. People can apply. It's a competitive RFA that the state set up. So I couldn't tell you, but it's a large waiver. I think there's a lot of interested groups. So potentially that other organizations would apply. I just don't know what I don't know. Justine made a comment. You didn't discuss much about the health equity piece. Is there not much known? Well, what we do know is that there is going to be a health equity oversight group, and they are going to be, it's going to be a statewide entity, a singular statewide entity. And from their perspective, it's hard because we don't know who that awardee is, and we don't know what is going to be their framework of collaborating. They will have to collaborate with each region, but what I don't know yet is, will that be a formal governance committee that's advisory, or is that going to be like a loosely organized stakeholders meeting? Like, how meaningful is our ability to collaborate with the HERO? And then also, what is the format and delivery model of how they share recommendations and do their assessments? It will be very interesting to see the things that they're reviewing and the things that they're assessing. But I have to assume there's going to be an application for the HERO. They're going to try to identify ways to organize with each region. And once we get involved in those planning meetings, we'll get more information about, what's the scope of their work and how are they going to, be supportive to each of the regions for the waiver.
Mark, I'm still confused about the health equity piece. Isn't really like services delivered by CBOs, like reimburse. I can't imagine it's reimbursable.
No,
it's outcomes related, like how well your organization,
it's
how well
outcomes related.
CBOs might meet, how well CBOs might meet health equity outcomes.
Yeah,
or your
so
region.
It's really the foundation of the whole waiver, Dr. Waldman. It's essentially the HERO is created to set the baseline for, how are we performing by region in addressing health disparities among marginalized populations, specifically those that qualify for these enhanced services, right? Because they're the most marginalized groups. And so, the services, the fee schedule, all of that's going to happen, but it has to happen in a way that advances health equity, which obviously we know means the system has to transform in order for that to be achieved. So while we haven't spent a lot of time today emphasizing that point, this waiver wouldn't exist without the intention of truly advancing health equity and helping to reduce health disparities across the entire state. So the HERO role is going to be important, and we're disappointed that it's not going to be established at the regional level. But I think that makes it even more important for us to be aligned as a region so that we can advocate, for what we feel are the needs for the folks that we're serving here, and also be very connected to the work that HERO, that statewide HERO, is doing in terms of defining the priorities. And then, of course, building harm reduction into all of that as well. So yeah, more to come on that. And hopefully you can be at the table to help us figure out how to make
Amy,
that
do you
successful.
see that coming out of like the Joanne Morin's role at the state level? Is it going to be like a DOH sort of thing, or they're going to get a separate, because she's now the health equity person at the state level?
Yeah, it'll be connected to the state, but they're gonna probably outsource it because it's
Okay.
very big data related. So it's going to require, an organization that can handle massive data and do the analytics associated with that data. But hopefully they'll pick somebody that has some experience with health equity and not just the data organization. So we'll see. But yeah, if there's a way to influence that at the state level, then we should pursue that.
Mark, there was a question asked in the question and answer box. It says, are there eligibility requirements for CBOs to participate?
That's a great question. I remember when Amir Basiri was overviewing the waiver previously, he said it's going to be really important that the engagement thresholds are very low, because we really want to promote the involvement of organizations. I've not seen organization requirements yet. There is going to be some connectivity requirements. The state also said privacy and security is really paramount, and they're going to hope to see social care networks get to be a high trust certified entity. How much of that gets passed down to organization, CBOs that are delivering services in a network is yet to be seen. So there definitely seems to be an amplification on technology standards and interfacing. But outside of that, I've not seen a lot of standards required by the waiver. Yeah, Joe. Joe,
I want to ask one more quick question. I'm sorry, which is you mentioned that this eventually would phase to a risk-based kind of model. Which is, I mean, there's all the talk about that, but is there still going to be pots of funding? Do you envision, or do they envision available to sort of fund the risk? I mean, you still have to, if you flip it to a value-based instead of risk-based model, somebody still has to pay, right? Is Medicaid going to become a value-based payer out of all this, or do you have any indication of where this transitions to after the 3 years are up?
Yeah, that's a great question. We don't know the answer to that, I think, in full. What the state is aspiring for is very lofty in terms of being able to achieve risk-based contracts for social care services in 3 years. So I'll start by saying that. But the exciting part about it is they're basically saying we want to bake the cost of social care services as part of the overall cost of healthcare moving forward. And that's huge progress if we can make, some big inroads around that point in particular during the waiver period, because what it means is, we're one step closer to looking at individuals holistically as opposed to in silos, and really getting to the root of, the challenges that are causing these health disparities. So it would be huge progress just if we were able to operate in that way without risk. Introducing risk, I think they haven't really thought through that. That's going to be something that, we're going to have to take baby steps for, but certainly we would not be putting our CBO partners at risk of not being successful in that environment. We want to be successful. So we'll be doing everything we can to advocate for a soft landing, shall I say.
Mark, there's another question in the chat. What would be the role, or are there funds available for hospitals and healthcare providers in administering the HRSN screenings and social care navigation?
Yep, those roles are more based on how the state is going to define them, and do you provide those services? So to the degree that you have a health system with a transportation program or with a nutrition assistance program, all of those things could still be delivered. So that's funding that's out there. I've been generically saying CBO, but it's really about these these services. The impression is that they're very heavily going to be CBO delivered, but I haven't seen any disqualifying elements yet that would say, if you deliver these social need interventions in the community, but you're a hospital, you can't do them. I've not seen any exclusions like that.
Mark,
yeah, I see a hand with Jesse.
hi, Mark, you had indicated or briefly touched on what organizations need to be doing, what CBOs need to be thinking about as they prepare to see if they can be a part of this. But I wondered if you could expand a little bit on that. Like I'm trying to determine how our agency, which is Helping Celebrate Abilities, or HCA, where is our place in this? I mean, obviously as a CBO, but what should we be asking ourselves as an organization to know or determine if this is something we should pursue?
Yeah, I mean, that's as we learn more, I guess the best answer to that I could give, a recommendation, would be to do exactly what you're doing right now. The waiver just came out. It's a thick document. Every time I talk to somebody and just rub shoulders on it, it refines my understanding of it. I think, from a Care Compass Network perspective, we're going to be busy organizing this full response to the RFA, which is going to be a whole lift in and of itself. But I think from a CBO perspective, if services aren't going to be coming out until August, September, October, you basically have between now and then to really understand what in the heck this waiver is saying. It's a lot of information. It's a lot of information to coalesce together. Justine's, calling that out. Well, we have this piece. What about the hero piece? And I think, these next few months is going to be a good time to absorb a lot of this information. And then be able to, answer that question over time. I don't think that you're going to know the answer to that, today. I think the more that we see that comes out of the waiver, the more that we see that comes out of the playbook they're going to release for the social care network is going to better speak to some of those things. The one, like, a question I get asked all the time is like, should I start staffing up now so I have staff that can do this work? And that's an impossible question for me to answer. That's an organizational decision. Do you have the funding for it? What's your risk appetite if the waiver, hits a road bump and now you've secured staff? I mean, there's so many variables with that one, but that's another very common one. And that just has to be an internal organizational decision. It'd be very difficult for me to make a recommendation on that.
Mark, can I chime in for a second?
Yeah.
Jesse, if you service Medicaid beneficiaries with health-related social needs, then I would presume that this would be something that you'd be interested in, correct? So HCA does that work, then I think it's it's important for your organization as well.
Thank you, Dr. Carter. Thanks, Mark.
Mark, there's another question in the chat. For the SCN application, will you need to form partnerships with CBOs during the application, or will you be doing that during contract development if awarded the contract?
That's going to be an evolving road. So we have an active network through Care Compass Network. Right now, we are going through onboarding partners to the IPA. But that's an open door. That's not going to close just because we've submitted our application for the waiver. We'll continue to onboard new organizations to the IPA all throughout the year. So it's been a journey. It's very methodical to go through that process. We do have, if you're interested in contracting with the IPA to join, it's the Care Compass supporting IPA. We do have some videos that you can review if you're an executive that's going to be reviewing the contract, just to facilitate the review timeline. So there are some resources we've made available to expedite it, but you could reach out to Bukam is here, right? Yes, if you have Bukam's contact information, but we can get that out. If you are interested or have questions on joining the IPA, certainly welcome, and just reach out to us and we can get that meeting scheduled. We are right at time. We're at 9:59. I want to thank you so much for joining out here today. I think clearly, I was looking at the participant list. We were in the upper 90s at the latter third of the meeting here. We're starting to drop some people. This meeting has been recorded. We'll send this out to the distribution list when the recording is ready. Feel free to share it. Obviously 7 slides, and we covered a full hour of just overview and discussion. So there's going to be a lot more downloading of information, a lot more conversations that we're going to have on this, but happy to have you join us today and just have the initial, let's break open the shell and start talking about the waiver as a region. So thank you so much for joining us today. More to come, and please send us any question that you have. We want to review it, field it. If you're thinking it, somebody else is thinking it, they just didn't have time to think about it yet. I guarantee we all have the same questions. So please let us know, and we'll be happy to get back to you. But we'll call that a break for this meeting, just in respect for everyone's time. I hope you have a great day, and we'll talk to you soon. Take care.